Hello, this is Kristen from Crossing Timbers Equine. Today we're going to discuss taking our horse's vital signs. With me today is Cat. He's my 26-year-old quarter horse. He's a been there, done that kind of a dude. When I have my students learn how to take temperatures and vital signs, he's the guy that I pull up for it. Today we're going to go over taking temperatures, taking the breath rate, the pulse rate, capillary refill time, and also the skin pinch test. Now, with Cat, like I said, he's a been there, done that. He knows what we're doing when we're taking his temperature. He's used to it. He's had it done many, many, many times. If you've got a horse that you don't know if they've ever had their temperature taken before, or if you've got a horse that's young and you know for a fact they've never had their temperature taken, I would definitely recommend having someone up to hold the horse instead of just tying them. When you're taking their temperature, it's vitally, vitally important that you remember you're working around the hind end. You want to make sure that you don't shift or move or stand in a position where you could potentially get kicked. You want to take it really nice and slow and easy until they get used to it and they're comfortable with it. One of my Arab mares, she doesn't like her tail being picked up. Once we get her tail up, she's okay with us taking her temperature, but she never really liked the idea of us picking up her tail. So we worked with that first until she got better, that we could reach under there and lift up her tail and bring it off to the side. And then after that, she was much better to take her temperature. To take Cat's temperature today, I have a digital thermometer. I have the end of it coated in a Vaseline substance. You want to make sure you use Vaseline or some sort of another lubricant, that you don't put the thermometer in there without anything to help ease it into the rectum. Now, I'm going to stand off to the side and make sure that I don't stand directly behind him when I go to take his temperature. With the digital thermometer, I'm going to want to push the on button, make sure everything's all set, ready to go before I put it into his rectum. As I stand here, I'm going to pull his tail off to the side, depending on where you're standing. And I'm going to lift his tail up and gently slide that thermometer right into his rectum. Now, as you can tell, Cat's been there, done that. He knows the drill, so he's just going to kind of stand here and hang out. But if your horse starts dancing, fidgeting around, pull that thermometer out, take a breath, start over again. The sphincter muscles in the rectum are very strong. If you don't have a good hold of your thermometer, that horse can actually suck that thermometer into their rectum, and then you're having a vet out to retrieve a thermometer. So make sure that you hold on to that thermometer and only take their temperature when you feel safe. Now, Cat's temperature came back at 99.1. A horse's average temperature is anywhere from 99.5 to 101.5. Some horses may tend to run a little warmer. Some horses may tend to run a little colder. The nice thing about taking their temperature once a week for a month or two, or you take it every day for a week or two in a row, is that you kind of get a baseline idea of what your horse's temperature is, how they run, hot or cold. So say a horse is going to run at 97.7, you'd know that if they had a temperature of 100, that's actually would probably mean a fever for them. Now, I want to state out loud and very, very firmly, I am not a vet. I know how to take temperatures. I've worked with horses, but I'm not a vet. So don't say, oh, my horse has a temperature of 100 degrees and they've got a fever. Take it for 2 weeks, see what they've got. If you're at all concerned at any point or any time, call your vet and ask your vet. They will be able to tell you if you should be concerned or not. So when taking that temperature, remember to stand off to the side. Never, never stand directly behind your horse. Lift that tail up and off to the side. Slide that thermometer that's been coated in Vaseline or some other lubricant into that rectum. Hold it until it beeps, and then pull it out and step back and away to read the thermometer and figure out what's going on. Taking their temperature is super important. It's a good thing to know. A lot of vets appreciate having a horse's temperature if you're calling them out for an emergency. So if you can give them a temperature, it helps give them a baseline of what they're coming into. When you're taking your horse's pulse or heart rate, there's a number of different areas that you can use to feel for his heart rate. A horse's average heart rate is 32 to 44 beats per minute. One of the first spots that you can try and check for that pulse rate is right back behind their jowls. You're going to reach your finger in right there and kind of hold it in a spot. Don't just keep moving it, moving it, moving it, moving it. Reach in, slide down the back of that jowl, back of that cheek, hold, see if you can feel anything. You're going to have to put a decent amount of pressure to feel through the skin and to find that vein. When the hairier they get, the harder it's going to get in there and find that. Now, as you can see, like Cat, he doesn't like his head being putzed with. He's no thanks. He's not a fan of that spot. So for him, I have a stethoscope that I use, and I will come in and I will check the heart rate right back here behind their elbow. Now, you really want to make sure you get that thermometer up and behind that elbow so that you can hear that heart rate. Another spot to check it is right on the bulb of their hoof, right back behind their fetlock. You can check for the digital pulse down there. A horse's respiratory rate is anywhere from 8 to 16 minutes breaths per minute while at rest. That rate will increase with exercise. One of the first ways you can use to take their breaths per minute is by watching the flare of their nostrils. Now, you want to make sure you saw when I put my hand over there to point, Cat wanted to stiff my hand to see if I had any snacks. So that will put off the breaths per minute. So just let them stand quietly on their own, keeping your hands to yourself, and watch the flare of the nostril. So remember, one breath is going to be an open and a close. That's one. Open and a close. That's two. The other place that you can watch their breaths per minute is on their barrel. You can watch the expansion and it coming in, expansion and coming in. That is also a good way to count breaths per minute. Just like when we did our pulse rate, we want to take 15 seconds, count how many breaths you get for 15 seconds, and then you're going to multiply that by 4 and get your average breaths per minute. When we do the skin pinch test, we're looking to see how hydrated our horse is. You want to grab the skin, give it a little pinch, and pull it up. If it makes a tent and stays, that might mean that your horse is dehydrated. If you pick the skin up, let it go, and it immediately springs back to form, then chances are your horse is very well hydrated. You want to perform the skin pinch test in an area where the skin is going to be fairly loose. You don't want to do it in a tight area. You want to do it where you can grab and pinch and watch it go back. Grab and pinch, watch it go back. One good spot to do it is on their neck. Now, it's hard when he's got a lot of hair like Cat does now. We're into November here in Wisconsin, so they're getting their furry coat. But feel, grab, pinch, and then kind of let your fingers just rest there to feel how quickly and how fastly that skin goes back down. So again, if that skin stays tented, then that means that your horse might possibly be dehydrated. If it springs back right away, then that means that your horse is most likely hydrated. When we perform the capillary refill test, we're looking to monitor the horse's hydration and their blood flow. The best place to perform the capillary refill test is on their gums. If they'll let you, you want to lift up their lip. You're going to take your thumb, push it into the gums for 2 or 3 seconds, and then you're going to let go. When you let go, you're going to watch to see how quickly that area goes from white to pink. When you push your thumb into the gums, it's going to have a white spot because you're pushing all the fluids and the blood out of that area. And then once you remove your thumb, the blood's going to flow back in. You want your capillary refill time to be within 1 to 2 seconds. If it's within that range, that tells you that your horse most likely has good blood flow and is hydrated. If it's slower or longer than that, it might possibly indicate there's an issue. Again, with all of these tests, it's a good idea to perform these tests and these exams on a regular basis so you get to know what your horse's standard is. Some horses might be quicker, some horses might take longer, and that's just how they are. But if you only do them once, then you don't have a baseline to put it against. You've probably heard your horse's belly rumble and grumble when you pull them up to brush them or tack them up or even while you're riding. Horses' gut sounds are a good thing. That tells us that their guts are working and processing the food that they've eaten. Their tummies don't grumble like ours do when they're hungry. Again, it means that there's things that are working in there, processing through, and you want to be able to hear gut sounds. Now, if the gut sounds are like a faucet where they're constant, continuous for over a minute, then that might be indicative of a problem. Any of these gut sounds that I discuss today, if you have any questions, please call and ask your vet. I'm sure your vet would be more than happy to discuss gut sounds with you. It gives them a good indicator if you think you have a horse that might be sick, that you can say, I heard gut sounds on the right, but not on the left. Again, it gives them a baseline to know what they might be coming into. When listening for gut sounds, you want to make sure that you keep yourself safe and secure. So I'm going to stand with my head facing his head, my bum by his bum, so that way he has a bad chance of trying to kick me because he's going to catch my whole body instead of my head. So if I were to stand this way and listen, he could come up and kick and catch my head, and that would not be good for any of us. So I'm going to stand this way. I'm just going to use my ear just to start. Keep a hand on him to let him know that I'm going to check his gut sounds, and I'm going to come down and listen. Now when I listen, I want to make sure that I'm moving and checking different areas. I want to check high, I want to check low, I want to check in the middle. So you want to listen for the gut sounds all around their gut. They have a bazillion miles of guts in here, large intestines, small intestines, and it's possible that the gut sounds are in one area and not another. You also want to make sure you listen to both sides. So if I've got a horse that I'm concerned that they might be colicking, I'm going to make sure I listen to the left, and I'm also going to listen to the right. When using a stethoscope, make sure that you place it in the area for a good 15 to 20 seconds before moving it to another area to listen to. Again, the gut sounds are going to move, and they might be possibly in different areas at different times. So you want to listen to the whole gut to get the whole idea of the gut sounds and what is going on in your horse's belly. If they've got gut sounds left and or right, That's a good thing. If you can't hear any gut sounds, 100% no gut sounds left or right, and your horse is exhibiting other symptoms, you might want to give your vet a call. Again, I've said it many, many times throughout this video. I am not a vet, I'm a trainer, but I've worked with enough horses that I feel comfortable and confident enough to give you this information. But please, please, please reach out to your vet if you have any questions or concerns. Your vet is the best and the first place you should go. The vets have so much knowledge, and they are the ones that are out there to help us take care of our horses. So again, please reach out to your vet if you have any questions or concerns.